Here I am, Black Dog Institute. It's an institute that's a combination of a not-for-profit and a medical research institute. And that was a picture of the closest beach, which is about 1 kilometre away. We have a program called Digital Dog, which involves a whole range of people working together from CSIRO, from 4 or 5 universities in Australia. And we're really basically trying to look at the question that the earlier speakers spoke about, which is less than 50% of people get mental health problems. It's particularly bad in adolescence. Suicide, 60 to 80% of suicides have not had a previous attempt. So we're not even looking at capturing people after they've made a suicide attempt. We have to try and get to them before they get there. How can technology help? And really, Digital Dog is basically about how we can do online, in-time, personalised, quick interventions for people at risk. So the rationale of the research program, which I'm going to talk about, is to provide these timely, evidence-based mental health assistance to those who's at risk, particularly of suicide now, using technology, but also to understand the causes of mental illness in its development by refining prediction, looking at timely risk factors, as Matt just spoke about, using social media, smartphones, combined with genetic and other traditional measures, and using, of course, the best possible machine learning and data analytics. And to give you an example of the sort of studies that we're doing at the moment, one is a 20,000 strong study of adolescents, which we're in the planning of. And what we want to combine is digital indices with social media, behavioural phenotypes, sorry that's put wrong, and genetic data. And by examining the effects of these factors on intervention. So it's not just looking at how people are and how they respond out there on all these indicators, but how do they respond to interventions? What are the risk factors for the non-responders as well as the responders? So this is just to give you an example really of one of the big studies that we're trying to do, which is 10,000 people in one arm and 10,000 people of the other. So you've got a nested longitudinal study implicitly in your randomized controlled trial to look at the effects of all of these different indices in predicting how mental illness develops. We've also just recently got a grant for a study of a $15 million study looking at suicide risk and how we can prevent suicide using regions of New South Wales. And what we want to do there is to put technology in schools and in other areas to our, we hope, 800,000 people who will be participating in that study. So of course, trying to do these research studies requires that we have to build capability on the smartphone to detect and deliver for our trials. So we have to build it on the individual smartphone because we want to deliver automatized interventions and we don't have enough people to be able to reach all of these people at one time. And the smartphone, of course, is the defining technology of our decade. It's only 8 years old, and when you think about that, it's just incredible what we've been able to do on a smartphone now. Even though I agree with Matt's description of us sitting there still doing face-to-face therapy after all these years. So our program is about detect and deliver. So on this side of the Prezi is things that we're doing to try and detect whether people are at risk of mental health or suicide. And of course the first basic thing that you can do is ask people. You can do adaptive testing to collect that sort of data very quickly. But what we've been really focusing on lately is trying to look at whether you can detect individual risk using blog and Twitter feeds. So it's looking at the linguistic features of speech and speech content to detect changes in mental health conditions. And I guess we've done 3 different things. The first is to look at real-time detection of mood using the Twitter feed. And we work with Amazon Web Services to do this. And basically over a week, we looked at 320 million emotional tweets harvested from around the world and developed an application which is available at wefeel.csiro, which collects the emotional tweets within 4 minutes of those tweets being tweeted. We actually get them flowing into this thing that looks like a nozzle, but the width of that strange shape here is the number of tweets across a 24-hour period, and this is the colour represents the emotion of those particular tweets. So what we wanted to do with that is just to look at that as a surveillance tool and see what we could do. So we tried to look at particular events to see if we can get these changes by looking at the emotional content of tweets from around the world. And this is the USA, UK and Australia. And this is an important thing for Australia. This was the reading of the budget in 2014, which that budget brought down the Prime Minister. And the peak that you can see in blue there, the turquoise, is Australia at the time of the reading of the budget. And that's anger, that colour. So you can see that it is possible with even this sort of technology, which is very broad scale, to predict events. And this is Robin Williams' death, which we were talking about before, where you can see the differences here between USA first, UK and Australia, and it's all been standardised for the number of tweets and so on. But you can see that, interestingly, the UK and Australia had more sad tweets proportionately as a result of his death than happened in the US. Okay, the other thing we've been looking at is mood tweets within particular online communities and across kind of counties and other areas to validate really what these tweets are doing. And this was just a quick analysis of 932 million tweets over a 2-year period, and then looking at those tweets if they contain the word suicide, and as a function of the counties across the USA. And what we found was, obviously, different counties have more suicide mentions of tweets than other counties, just by the depth of the colour there. But also you get changes over a 12-month period in the frequency with which the particular tweet's been operational. We've also been looking at teaching machines to learn to identify concerning and non-concerning tweets. And we found that the iterator reliability for concerning tweets is around about 79%, and that we can train machines to be able to identify concerning from non-concerning tweets, as well as humans. And I think a lot of people are doing this sort of research as well. But it seemed to indicate to us that you really shouldn't be doing too much with that, because our accuracy by itself with just that tweet is not enough to be able to intervene because of the false positives. And finally, we've been trying to work out answer the very hard question of whether we can work on identifying individual characteristics of people who blog longitudinally. So we've been doing these ground truth studies where we've followed people on blogs, such as Reddit and other things, and tried to look at how the particular features of the tweets correlate with the individual changes in depression scores of individuals on those tweets. So this is just an example of one subject where this is across August, September, October, November, December, and this is both PHQ-9 and a measure of achievement for this particular subject, which had quite a strong correlation at that individual level with changes in PHQ scores. So I think we are getting there. This is another example of a similar sort of correlation at the individual level, which is a kind of what we're trying to do, I guess, in trying to track what's happening to people out there who are not on the radar of mental health services. We've also looking at voice detection, but I'm not going to talk about that today. We've also been looking at direct connectedness using Bluetooth methodologies, many of which were developed at MIT, but what we're trying to do here is look at social connectivity, because withdrawal from people is a key mental health response. And we want to understand whether we can pick that up on a smartphone about real face-to-face interaction. So it's not just people digitally talking to each other as measured by the smartphone, but can we actually get the smartphone to do something to tell us if these people are withdrawing from their friends? And we did the first study within the Black Dog Institute. It was quite interesting. Nobody wanted to sign up for it because it would mean you'd be able to tell who's talking to who shares a room together, who might be seeing each other at different points, etc., etc. We only got about 30% of participants, employees of the Institute signing up. But we did actually validate, if you like, on their own mobile phones, Android and iOS, that we could pick up different patterns of how people were communicating with each other, and that it did correlate with real core indicators like when we had meetings and so on and so forth. We looked at validating it against the Pentland sociometric badges and actually found that this particular technology was able to pick up, if not more, of the face-to-face interactions that people were having across the Institute. And we've just gone on now to do a study of an organisation where almost everyone signed up to be involved. Here we've got mental health scores across there. We've got PHQ-9, GAD-7, and the CIDUS, which measures suicide ideation. And what you can see is, just look at the red dots, because what we want to do with this is look at how social networks work when you build the social networks based on the Bluetoothing of the phones. And, you know, Acker, Nicholas, Christakis, but our early work, at least in the first 30 people that we've been looking at here, showed that these people at risk of suicide do tend to be on the edges, and it's something that we're looking forward to looking at over a longitudinal period of time. So all of that's on the detect side. What about the delivery side, which I think does tend to get not so much interest? So we know that digital therapies have worked for a long time. We know that 22% of depression can be reduced by these online dinosaur programs that have been around for nearly 15 years or more. And indeed, they can distribute it to millions of people around the world. And this is just something in JAMA this week, showing again that web-based, guided, in this case, self-help intervention was effective in reducing depression and preventing people from developing depression with sub-threshold symptoms. And we've done our own work here in a paper that came out in Lancet Psychiatry a couple of months ago, which showed that an online program called Shut-Eye, which was developed at University of Virginia, was effective over a 6-month period in reducing symptoms of depression. This was an insomnia program. So it's a program designed to treat insomnia that has this effect on depression. And that's quite important because insomnia is not something that people are necessarily ashamed of having. They're actually proud of how many nights they've gone without sleeping properly. And so you can get people to enroll and they go, wow, I'm going to improve my sleep. They talk about it. And you actually get this effect. But more interestingly, and I think from a mechanistic point of view, more interestingly, this intervention also had an effect on suicide ideation. So there are ways that we can get to people using these online programs, I think. Now the number needed to treat on these are something like 1 in 6, which is really good if you compare that the number needed to treat for a statin is 1 in 300. So there are effective programs already out there that can be used, that can be improved by all the work that people are doing, but nevertheless, I think it's important to know we do have some things that can be used right now. And we are in fact looking at an app that's into its second randomized controlled trial now at a population level, and it uses acceptance commitment therapy to collect and deliver an intervention to Indigenous Australians called iBobly. And this is the shift you get in the use of the app, which was co-designed with the community, and we get changes in ideation, distress, depression, but not impulsivity. So we do even have apps now that will deliver this kind of traditional way of doing things. And if you also think about suicide prevention, the idea is, of course, to bring people earlier into the picture rather than later. And so this is a study that we did with Sally Merry from University of Auckland, where she has a game called Sparks, which was used for treatment, and we modified it to use it for prevention, and we got strong effects on depression score. The idea in this trial was to compare a stress diathesis model. So we put this intervention in prior to the higher school certificate examination of people to see if we could avert the level of misery that was going to be caused to them and their parents. I don't know if anyone's put their kids through high school here, but I had 3 kids in 4 years doing the exam, and I felt like I needed the most psychotherapy than anybody else. But it's a very nice game. It's got nice story, it's got appealing look, and the kids like it. Even older kids like it. These were 18-year-olds, some of them. This is the character I created for myself, obviously wanting to be somebody who I'm not. Anyway, so I just finished with a few of the issues, I think. The issue is how to link detect and deliver. And this covers issues we're all dealing with between privacy, intrusion, acceptability, and systems like Ginger.io and people like that are really working very hard, I think, on being able to pull together this sort of issue. We have to think about how the quantified self and healthcare link. You know, healthcare is key. People need healthcare, but we also have wonderful wellness and purpose apps to increase our level of purpose. And this one I really enjoyed hearing about at the recent conference we had in Seattle, which is called Jewel, and it's developed by Victor Strecker, and it's about how to get communities to gain more interest in the direction of their lives. Finally, I think we've got all these organisations, we don't really know exactly what they're doing, but they've got tens of thousands of people that they're continuing updating versions of their interventions. And this is something that I think we need to work with the industry, otherwise we're just really going to be left behind. And finally, I think we have to think about how we need to work together to integrate the fine-grained work done every day by all of us and the bigger picture about what we're trying to change in the context of changes in speed of technology. So thank you very much.